Because the perineal lacerations, perineal laceration during your normal vaginal delivery. What is this is the Sultans classification. Sultans classifications of perineal tear. Okay, so basically the first degree perineal tear, it will usually involve the perineal skin. Okay, this is the first degree perineal tear. The second degree perineal tear usually involves the perineal body and the deeper tissue, that is your muscles layers, that is your bulbous spongious muscles and your superficial transverse perineal muscles. So basically the first degree and secondary. The first degree is the perineal muscle, that is when you cut with your episiotomy scissor, you cut the perineal the mucosa, the vaginal mucosa and the muscle. Mucosa is the first degree. Second degree involving the muscles, that is the perineal body and the deeper tissue, the muscle layer. In the muscle there will be two muscles, one is your bulbar spongious and another is your superficial transverse perineal muscles. This is a vaginal mucosa. Okay, then the second degree. After this, the third degree is extends into the capsules and the muscle of the rectal sphincters. Again the muscles, it is based on the whether it is involved the external anal sphincter or the internal anal sphincters. If the again the third degree is divided into 3A, 3B and 3C. In the 3A, if it is involved less than 50% of external anal sphincters, this is your external anal sphincters. Okay, if it is involved less than 50% of external, if it is involved more than 50% of external anal sphincters, that is 3B. 3C is involved the both external plus internal anal sphincters, that is 3C. So very important. 3A, 3B, 3B is the extension into the capsules and the muscle of the external sphincters. In the external anal sphincter, 3A is less than 50% external anal sphincter complex and 3B is the more than 50% of the external anal sphincter complex, and 3C is involved the both external and the internal anal sphincters. Again in the fourth degree, the extension through the sphincters into the rectal mucosa. You can see this is the internal anal sphincters, its tear, and the rectal mucosa also tears. This last two, that is the third and fourth degree, is called as OASIS, that is called obstetrics anal sphincter injury, obstetric anal sphincter injuries. Okay, so basically this is the complete perineal tear. This is the third and fourth degree is called as CPT. Okay, complete perineal tear. Okay, so basically the Sultans classification system of perineal tear, they have divided first degree, second degree, third degree, fourth degree. In the first degree, it involves the vaginal mucosa. Second degree involves the perineal body and the muscle tissue. In the muscle tissue, it involves bulbous spongious and superficial transverse perineal muscles. In the third degree, there will be involve the capsules and the muscle of the rectal sphincter. Again, the muscles external sphincter and internal sphincter. Based on that, they have divided 3A, 3B, 3C. 3A is less than 50% of the external sphincter complex. 3B is more than 50% of the external sphincter complex. In 3C is external sphincters plus internal sphincters, both 100%, and the fourth degree is the extension through the sphincter in external internal sphincter through the rectal mucosa, and you can see the rectal mucosa has been turned out. This is the internal sphincters. Okay, if you like this, please subscribe. Thank you.